A warm welcome to everyone from all of us here at NKTI. The National Kidney Month was started through a presidential proclamation number 184 of then President Fidel B. Ramos. Because in 1993, they were recording 6,000 kidney deaths per year. And ever since then, the NKTI has been very faithfully leading the celebration of the National Kidney Month, which is to promote awareness and the importance of kidney health and in the prevention of kidney disease, which is the mandate or the very reason why NKTI exists. The very reason why we have a month-long celebration of June as the Kidney Month is we have laid down activities, programs, lay fora, lectures for both our hospital staff, the general public, on increasing awareness of the importance of kidney health. And for the general public, we go out to the community and increase awareness by lay fora, by going and doing some sort of a medical mission in raising awareness and in fact doing laboratory tests and probably partnering with interested local government agencies and units so that they can now extend what NKTI is doing. Well, let's talk about technology first, where NKTI has invested heavily in technology for the delivery of the so-called accessible, affordable, and quality healthcare for all, which is the essence of universal healthcare. First of all, there are technologies that we invested on 20 years ago, which is now the standard, and this is relying on minimally invasive techniques so that with the use of modern equipment, we can now help in faster recovery, turnaround time of patients, and more efficient quality outcomes. We fast forward to today. You heard about robotics. Robotics increases the efficiency, the quality, and the finesse of the type of surgery. Another is the use of the so-called life port that we use in preserving kidneys that we retrieve from deceased organs. In the past, whenever we do retrieval for deceased organ donation, we get the kidneys, we put them in an ice chest or a cooler. Now, with the life port, which is again a high technology device, it can now preserve up to 72 hours the viability of the kidney so that you can better prepare the recipient and you can have better outcomes. In fact, many of these patients immediately after transplantation, the kidney functions right away. LINAC is another. It is not an emerging technology. It is an accepted technology. And LINAC is actually one of the modalities that we use to treat cancer. While we are not a cancer center, we also have patients who has cancer in the kidneys, in the bladder, and particularly the prostate. The prostate is one of the organs that has actually gained a lot of attention recently because of the increased incidence of prostate cancer, not increasing, but because there is now an awareness. If diagnosed early, it can be treated with a curative intent. Okay, integrated approach involves advocacy first. Advocacy is going out not only to the medical and to the non-medical community. It involves awareness. It involves education. It involves convincing people that despite the negative impact of socio-cultural beliefs, superstitious beliefs, we are able to make use of their organs and be able to actually help people live a longer life, a better life, and something that is better than just being on dialysis forever. I'm talking about the kidneys only, because the maturity of organ transplants in this country is centered on kidney transplants. But nowadays, you've probably heard of multi-organ donation, because when we do the retrievals, there is now a clamor for those who needs the liver, the pancreas, the heart, the lungs, even the bones, part of the eye, which is the cornea. So, education is there, but we need a strengthening of the law. Because as to the law that exists now, we still have to secure consent from the family, the next of kin, for us to be able to proceed. Whereas in other countries, because it is in the law, it is actually part of the country's advocacy to be able to have that part of the state actually securing the organs that they need. Bughaw, blue. That is the color of NKTI. To many people, you look at the blue skies, you look at the blue calm ocean. That is a symbol of peace, serenity, stability. And this theme was chosen for this year's celebration because with a blue atmosphere, you are able to think of other things rather than to think about having to go through dialysis every 3 days, having to go through a life wherein you are waiting for a donor, having to go through so many tests. Whereas if you go now to the blue horizon of prevention, you will not even step into chronic kidney disease stage 1. But that will happen if you start today. And in whatever stage you are in prevention, our message is, it's never too late. It's never too late to, first of all, identify what are the key factors in prevention. And if you know what causes it, and in this country, the most common preventable conditions is hypertension or high blood pressure, diabetes or uncontrolled blood sugar, or a combination of both, and you know these are lifestyle diseases, then we can go back to the grassroots because this is where primary care is. And that's why our strategy is from both ends of the disease condition. Prevention up to treatment and rehabilitation. And we are very strong on nutrition. And therefore, a healthy lifestyle not only will sit well with the healthy kidneys, but it will sit very well with a healthy life.